And now, the superstar of alternative health and purveyor of medical truth, Dr. Joel Wallach.
Good afternoon and welcome. This is nutritional pharmacist Melissa Golloday. I am a registered pharmacist with a passion for nutrition. I have been practicing as a traditional pharmacist for over 15 years. I graduated back in 1999. And throughout my career, I've been able to see approximately 300 to 800 people a day, depending on what kind of setting I was working at or what store I was working at. And one of the things I noticed when I started my practice is that a patient would come in, start on one medication, and then I'd see them a couple months later and they would be adding a second medication to their regimen. And I would slowly see people get sicker. And when I first got out of school, this was very disheartening to me because I became a medical professional to help people get better, and that was not what I was seeing in traditional practice. At the same time, I had the luck of coming across a man named Pharmacist Ben, who some of you I'm sure know from, he fills in with Doc also, and he taught me what actually we've known for a really long time in medicine, which is that our bodies know best, and our bodies can be our physicians and can heal us. And if we give ourselves the best nutrition and let the healing be done by the greatest physician, which is our body. So it's an amazing journey to know that and to learn that. And through the last 15 years, I'd say maybe 1 out of 20 patients I would see would be open. I could just kind of tell they were hungry for something just a little extra. And I was able to share lifestyle changes and, eating some nutrients could change their life. And one of the big things I focused on, of course, was gluten and getting some nutrients on board. And what I love most about longevity is that we do have the 90 essential nutrients for life, very easy formulations to take. People get started on this. They have immediate turnarounds. I've been practicing with longevity now since earlier this year of 2016. And the experiences I'm having, I was already a believer, but seeing what's happening in front of my very own eyes is unbelievable. I'm seeing people literally come back. They're immobile, cannot move, and they're getting out of bed. They're bounding out of bed. They're having a new life, and we do owe this to Doc Wallach and his mission, and it's a real honor to be a part of it. I just wanted to go back a little bit more and discuss how the concept of maybe you'd start on one medication and why you'd end up on more. And the reason is we take these drugs and they target just a specific pathway in the body, and they're not dealing with any sort of underlying condition. They're not treating the organs. They're not dealing with what might be happening that actually needs to be healed. And it's always a nutrient issue, an absorption or a nutrient issue. And if we can correct those things, which is what longevity does, the person's body is actually able to do the healing. Traditional medicine doesn't do that. Pharmaceuticals do not deal with the underlying conditions. They technically mask the symptoms. So, for example, they're going to, take Motrin. It's going to stop your prostaglandin synthesis. It's going to stop the inflammatory response, but it's not going to repair anything. It's not going to deal with why you're having that inflammatory response. Longevity products and the longevity way of life does do that. It teaches us how to eat and adding the nutrients so that it allows the body to actually regenerate and rebuild. It's a very amazing program. And just looking at why we don't get the nutrients we don't get anymore due to soil depletion. 100 years ago when we would eat off the farm, we were getting the nutrients we need based on farming techniques that don't exist in this country anymore the way they used to. We're using pesticides and various different fertilizers that beef up supply of the food chain, but the nutrient profiles are way lower. Our food is actually nutrient deficient, so we're eating empty calories. The empty calories are also contributing to the obesity epidemic that we're seeing in this country. So our kids, when they're eating at the school cafeteria, they're not actually eating any calories or getting any nutrients, and then their bodies are consistently sending the signal that they're hungry, so they keep going out to eat. And of course, as they keep eating empty calories, which leads to them getting obese. And there's a huge obesity epidemic at portions that we've never seen, and this is something that's really going to lead to a lot of problems. And guess what? It doesn't have to be so. You get your kids on the longevity products, beyond tangy tangerine, it's instant what could happen. People start dropping weight right away. They start dropping water weight because of, the inflammatory response is allowed to run out of the body. They're actually getting nutriated. Their body starts repairing. Pain starts going away. Really amazing thing to see. So, again, really happy to be here with all of you today and looking forward to your calls. Thank you.
Yeah, Melissa, it's great to have you back on today. And, I was going to ask you that, Ben Fuchs, who you know well, had told me that, part of what got him into being a nutritional pharmacist was that, he was seeing these people bring in their prescriptions, and he's like, well, bring me everything you're taking so that I know whether you're going to have any interaction problems or not. And he said, people would bring in grocery sacks full of medications, 20, 30 pharmaceutical prescriptions. And did you have that same type of similar experience? Is that partly what brought you to become a nutritional pharmacist rather than being one that doles out drugs?
Yes, sir. And again, the big impetus was watching people get sicker. And it broke my heart because they were doing what they thought was right. They were going to the doctor, they have insurance, they come to the pharmacy, they get their prescription filled, and they weren't feeling better. And people would actually come to the counter and they would cry because they were so frustrated. And they were at the end of their rope. And the only answer the docs had was to usually add another prescription medication. So it's a real heartbreaker. It's a rampant epidemic. And if you're in that condition, you don't need to be.
You're listening to Dead Doctors Don't Lie on the ZBS Radio Network with your host today, Melissa Golloday. She's a nutritional pharmacist filling in for Dr. Wallach today. And if you've ever had trouble getting into the show, I've had people call and say, I've been trying to get in for 2 weeks. Today, we do have some open lines. Call us on the priority line, 831-685-1080. Lines open. And we are back on Dead Doctors Don't Lie on the ZBS Radio Network. And filling in for Dr. Joel Wallach today, we do have nutritional pharmacist Melissa Golloday. Welcome back to the show, Melissa.
Thanks, Doug. It's great to be back.
And I've got a story here in my Pearls of Wisdom segment here where it kind of shocked me. It really didn't surprise me that much because of all the years I've worked on this show and the research I've done. But I was kind of surprised at the percentages here, and this is a Fox News story headline, Newspaper Investigation Reveals Dangerous Pharmacy Oversight May Be Putting Patients at Risk. It's a 2-year investigation led by the Chicago Tribune revealed a hazardous trend involving pharmacists dispensing dangerous drug pairings without warning patients. 52% of the 255 pharmacies that were involved in the investigation were not telling people about these deadly consequences of pairing these drugs together. And for their tests, they they sent out 15 reporters to various CVS, Walgreens, Walmart, Kmart, and Costco pharmacies, as well as some local independent pharmacies. And what they were looking for was the prescriptions for clarithromycin, which is an antibiotic, and simvastatin, which is a cholesterol drug. And they say taking these drugs, singly, by themselves, that they're quite safe. But then when you combine the two, you run the risk of a breakdown in muscle tissue that could lead to kidney failure and potentially death. And they say the investigation was conducted in the Chicago area, Indiana, Wisconsin, and Michigan. And they did point out that in Illinois, there's a regulation that requires pharmacists who identify a dangerous drug pairing to contact the prescribing doctor to verify the order and then alert the patient. However, this wasn't being done. Found that CVS pharmacists failed to warn patients of these potential problems 63% of the time. Walgreens was at 30%. Kmart pharmacists 60%. Walmart, 43%. Costco also failed at 60%. Say the pharmaceutical chains had an overall 49% failure rate, with Walgreens, CVS, Kmart, and Walmart all vowing that they're going to issue some edicts to their staff and technicians as a result of the investigation. According to CVS Vice President Tom Davis, says there is a very high sense of urgency to pursue this issue and get to the root of the cause. And they say, though the big chain pharmacies scored poorly, including the independent pharmacies didn't do much better because they were missing the risky interactions 72% of the time, according to Carmen Catazone, the executive director of the National Association of Boards of Pharmacy, says anytime there's a serious interaction, there's no excuse for the pharmacist not warning the patient about the interaction. And they actually talked to one Walmart pharmacist, and they told the Tribune that she fills 200 prescriptions in a 9-hour shift. And I did the math on that, Melissa, and that's approximately one prescription every minute. I mean, how can you not make some mistakes if you're doing it that often?
Yes, there's a lot there to explore. One of the big things I want to point out to the patients that are listening, please get all your prescriptions at one pharmacy. So one of the big ways things like this happen is you might get your simvastatin somewhere else, and then for convenience, you might fill your clarithromycin at another pharmacy. Well, not all systems are linked. Now, if you were to pick Walgreens, then there's there's usually an overlap between the systems that would catch these kind of interactions. One of the things that frustrated me too about the traditional medical model, it doesn't put a lot of responsibility on the patient, and the patient needs to be responsible for their own health. So one of the great things about longevity is we teach people how to take their power of their health and utilize it and empower themselves. So when you get stuck in the medical model, you start to give all your power away and assume that the doctor's going to cure you, the nurse is going to save you, the pharmacist is going to save you. Well, guess what? They're not. It's up to you to save yourself. So as a patient, you need to be vigilant and pay attention. Another thing, you open your bottle, the pills don't look the same. Really easy. You can get online, punch in the digits in Google. It'll tell you what the pill is. You can also call your pharmacy. They can double check what they dispense. As a patient, you have a responsibility to know what's going in your body just as much as anybody else. So, and as our medical system continues to get, more and more burdened with the huge amounts of geriatric patients that are happening, and just something to be thinking about. So you as the patient, please become empowered and pay attention to what you're taking. And she's right, the last commentary about knowing, pharmacists do have a duty. They do, and they definitely are, doing the best they can, and mistakes do happen. So that's all true.
And we are back on Dead Doctors Don't Lie on the ZBS Radio Network with your host today, nutritional pharmacist Melissa Golloday, filling in for Dr. Wallach. Welcome back to the show, Melissa.
Thank you, Doug. Really happy to be here today. And just before the commercial break, we were discussing patients, and I was encouraging them to keep their prescriptions all at one pharmacy. And the reason for this is you have a better chance of pharmacists catching any errors or any interactions that might be going on with your medications. The other reason, there's a lot of reasons, but another one is you build a relationship with the people on site there, and you have you can build a team that's involved in your health care, and keeping it in one place to the best of your ability is highly ideal. I know a lot of patients will, go to Walmart because it's $4 there, and then it's, maybe a cheaper cash price over there. The reality is if you're going to go to Walmart to do the $4 script, then just take everything over there. Just keep it simple so interactions like we're talking about don't happen. Another thing that'll end up happening is if patients, they're not as, attentive to what they're taking, they could end up going into the hospital. The doctor could prescribe, for example, another cholesterol-lowering medication, and you could take that home as a patient and continue taking previous medications and not even know you're taking 2 cholesterol medications. I've actually seen that. I had an elderly patient bring in a bag of medications. I sorted them out for her. She was actually on 2 cholesterol-lowering medications and 2 ACE inhibitors. She did not need to be on both of those, and honestly, it's a bit of a miracle that she was alive and bringing these medications to me. And our health takes vigilance, and the only one responsible for it is you. What's great about longevity is we provide you tools to become more empowered, yet nevertheless, you are the person that knows what you need. You know how you feel when you take certain nutrients. You know how you feel when you eat certain foods. You know how you feel when you do certain exercises. You're the best assessor of what your body needs. And one of the flaws that I see in our current medical model is we go into it and we give all our power away to other people. These other people are doing the best they can. They've been trained the way they've been trained, which in some situations isn't the best. That's what happens. Trainings aren't always the best. Existing models aren't always the best. And you're giving away your power to people that might not actually know better. I personally love the medical model for acute injury, emergency care. I definitely utilize it for that. I also like to utilize it to get laboratory tests, et cetera, to kind of see where I'm at. And then with my team, I have an acupuncturist that I work with and, a massage therapist. And through those people and through longevity, I kind of just tweak myself out and continue going forward with my health. And I'm really maintaining pretty good health considering where I'm at in my life. And, the greatest medicine is to teach people how not to need it. And that is what we do at Longevity. We teach you how to nutriate, what to eat, what to stay away from in regards to your diet, and your life will be vibrant. It's pretty amazing. We can live long, healthy lives, and suffering is optional. So depending on the choices we make today will tell us how our tomorrow is going to be. So what the choices we make today, what we eat today, what we nutriate with today has an impact on us.
Let's head to Arkansas, and Jim, you are on with Melissa Golloday.
Okay.
Hi, Jim. What can I do for you today?
A friend of mine, she's a nurse, and she slipped onto the ice. She's in her middle age. She's a smoker, but she crushed her hip. They put her back together. How can she heal up real quick?
The best thing to do, Jim, is to get her started on the Healthy Body Start Pack. That's going to be the Beyond Tangy Tangerine, the Ultimate EFAs, which are the fish oils, and the OsteoFX. The OsteoFX is going to specifically target reknitting of the bones, but the whole pack is really essential for where she's at. She's had a trauma, she has inflammation, and not only that, you told me she's a smoker, so we're also dealing with just a lot of things going on in her body. So if we start there, we can at least get her stabilized, and that's going to assist with the repair. I also would add the CM cream to that, and that is an anti-inflammatory cream she can massage into that area. And so did they operate and she has stitches? Is that where she's at?
Yeah, she's in the med. Listen, what did you say before just then?
Not sure. Healthy Body Start Pack, and she would do the Beyond Tangy Tangerine plus the Ultimate EFAs and the OsteoFX. And then, yes, sir, that's all in the Healthy Body Start Pack. Healthy Body Start Pack 2.0 is the one I prefer. The 2.0 has a broader, more dense nutrients in the Beyond Tangy Tangerine. And that's where I would get her at. And also, I'm going to give you my email, and you can email me directly, and we can, add a few other additional items as she gets stabilized. So my email is Melissa, Melissa, and it's at nutritionalpharmacist.com. And again, it's Melissa, Melissa. So go ahead and touch base with me about that, and I'll have some more questions for you too. But I definitely, Healthy Body Start Pack is where we're going to start her off.
Okay, let's head on to California, and Gary, you're on with Melissa Golloday.
Melissa, thanks for taking the call. I've got a new cancer patient. I just want to know what we should probably recommend besides the brain and heart pack.
So tell me what's going on, Gary. Who's the patient?
It's a downline of mine. It's a person that's just picked up cancer, diagnosed with cancer. And so I'm right off the top of my head, I think it's a brain and heart pack plus something else. But you just
Yeah,
amplify my
tell me the
thoughts.
cancer, what type of cancer?
I don't know that. I'm sorry.
Okay, no worries. It's okay. Just curious if it's spread or metastasized. The number one thing, we're always dealing with mindset, right? And everything in life. The number one thing is they need to change their mindset from, because cancer is a very scary diagnosis. And so one of the first things I like to do with patients is to get them to focus on feeling better, right? Not focusing on eradicating the cancer, because that's just driving that whole diagnosis deeper into their awareness. They want to focus on feeling better. Where are they feeling? We add the brain and heart pack. They're going to start feeling better. So keeping that around them, that your energy level is what's important, your state of mind. So definitely, things that are going to keep them in good spirit, positive affirmation. Louise Hayes does a lot of work, heal your body. Those things would be really important. And then we'll definitely add the Fucoid Z to that regimen.
Welcome back.
Hi, Gary.
Thanks, Melissa.
You're
Thanks
welcome.
I really like that, getting away from the focus of the diagnosis and get back to making them feel better. It just puts them in a state of mind that's ready to go. But is there anything else besides the Fucoid Z that I should be considering offering them to them?
Yes, definitely. We have a product. It's the BTT tablet. And the reason we love it so much is it has a really high ORAC account. It's got 160,000 per dose, which is per 4 tablets. So what I would like your patient to do is get on 8 tablets a day. We're going to get him up at, 320,000 ORAC a day. And what that is going to do is going to provide a huge blast of antioxidants. And it's going to calm the system down and just get that whole oxidation process that's going on calmed down. So, and then the Fucoid Z is going to do a similar thing, but it's also going to be driving out the inflammation. So what I would like you to do is get 2 bottles of the BTT tablet 2.0 and also 2 bottles of the Fucoid Z. And I would recommend 2 caps of the Fucoid Z twice a day. So in addition to the whole brain and heart pack, you're going to add the BTT 8 tablets a day plus the Fucoid Z 2 caps 2 times a day. And if you have any questions on that, Gary, please send me an email at Melissa, MELISSA, at nutritionalpharmacist.com. And I'd really love to help you guys through this process. And there's so many resources out there. And like you were saying, mental state is huge. Mental and spiritual state is a huge component, really, to any disease. But when we're dealing with cancer, it can happen. If the patient believes it can happen, it can happen. This can go away. And so thank you, Gary. Thanks for calling.
All right, let's head to Arkansas. And Daniel, you're on with Melissa Golloday.
Hello?
Hi, Daniel. What can I do for you today?
Okay, let me tell you, I'll give you a little bit of history here. I'm 70 years old, about 350 pounds. I'm overweight, I know it, but I've been there my whole life. I retired about 4 years ago, and about 2 years after I retired, my hip went out. And they say that the ligaments between my joints are wore out. And I can walk with a cane pretty good, and I don't have much problems. I just wondered if there's anything I can take to help put that cartridge back into my joints.
Definitely, Daniel. Again, like I like to start all my patients on the Healthy Body Start Pack 2.0. It's an easy start point. We could also start you on the Bone and Joint Pack, which would be specific for the joints. So that would be something to think. It's definitely a little bit more of an investment, but it's the Healthy Body Bone and Joint Pack. And all that together, if you follow that regimen, you're going to start getting better and you're going to start rebuilding your body. And the one other thing that you need to pay attention to is what you're eating. You need to give up gluten, and that's really hard. Most of us struggle with that a lot, especially around the holidays. But you know what? You're worth it. And if you do it now, where you're going to be in a year from now, you won't believe, right? You give up gluten, which means no pizza, no cupcakes, no cake, all the things that most of us eat, especially around the holidays. If you give it up, you're going to notice your inflammation is going to start going down right away. You're going to be able to move. That weight gain, the fact that you've been a big guy, there's definitely some, issues to that some of us just are naturally big. But the reality is you're eating things you're allergic to, and that's what's assisted in your weight and also just the tear down of the joints and the cartilage. And you can have a great retirement. It's possible. So just keep tuning into longevity. There's tons of resources out there, but for you, definitely starting with the Healthy Body Start Pack, the bone and joint formulation, staying away from gluten, not eating the bad foods that Doc talks about, which, Doug, could you share the bad food list, please?
Yeah, you want to stay away from all oils. You want to stay away from burnt meat, and you want to stay away from even mayonnaise and things like that. Stay away from fried foods, and pretty much stay away from the sweets as well.
Excellent. Thank you, Doug. Thank you, Daniel. Good luck.
And let's head on to California. And David, you're on with nutritional pharmacist Melissa Golloday.
Hello.
Hi, David. What can I do for you today?
Hi, Melissa. My nephew is about 26 years old, and he has alopecia. He had it when he was a kid in junior high school, and he had blotchy hair on his head, and then he grew out of it, I guess, or they thought he grew out of it. And he got married about 3 years ago, to the 13th, 2013. And he has lost all his hair now. And he's kind of at his wits' end. He's been to nutritionists. He's been to doctors. And the only thing he gets is little blotches coming back. So I thought I might be able to call you guys and see if we couldn't help him.
I do believe we would be able to help him. I know that the testosterone levels, stress levels, all of those things contribute to our hair growth. And is he currently taking any longevity products?
No, he's not.
Okay, and how old? You said he was 26, and he's completely lost all his hair right now?
Yes.
Okay.
His legs, his hair,
Wow.
at his face, everything. He's about 6 foot tall, 170 pounds, good shape. He is a basketball coach, so he exercises a lot. But
there's definitely something. Yeah, there's definitely something going on with his hormones in regards to losing his hair all over his body, and just to shoot a regimen right off the cuff like this, it's not familiar with that. Doug, do you have any feedback on that?
Well, I do know that Dr. Wallach says that hair loss is as a result of a tin deficiency, so you might want to get products where there is some tin in the product would be the only thing I could say. Yeah,
so, David, please email me too. It's Melissa at nutritionalpharmacist.com. It's MELISSA. But I definitely want to help you guys out. But as Doug said, getting a supplementation, beyond tangy tangerine, just starting him on the Healthy Body Start Pack is going to be a great way to go, because clearly something's going on, right? There's stress, there's hormone imbalances, and he needs to get stabilized. And one of the quickest ways to stabilize is the Healthy Body Start Pack, not eating bad foods, right? Gluten, fried foods, sweets. We make those few changes, and everything just starts clicking back together. As far as specifically, it's going to be something that he's going to have to experiment with. But that alone, the Healthy Body Start Pack, is going to help with inflammation and stress and just getting him stabilized. So please go ahead and get him started there.
Might also recommend him getting the hair, skin, and nails product as well, that's specifically designed for promoting hair growth and nail growth and that kind of thing.
Okay. Excellent.
And we're just about 30 seconds away from a break here. When you were talking earlier today about taking all of your prescriptions to the same pharmacy, would there ever be a case where a pharmacy wouldn't have the drug?
Yes, there would be. And, when I was mentioning earlier about patients taking all their prescriptions to one pharmacy, I would like to say that the best choice out there would be an independent pharmacy. You're going to get that personal service. You're also going to get a pharmacist that has time to talk to you. And yes, pharmacies run out of medications. That happens. And when that happens, you do have to make a leap to get your medication right away. But circle back and take your business back to your home pharmacy.
And we are back on Dead Doctors Don't Lie on the ZBS Radio Network. And filling in for Dr. Joel Wallach today, we do have nutritional pharmacist Melissa Golloday. Welcome back to the show, Melissa.
Thanks, Doug. It's great to be here. Looking forward to more calls.
All right, let's head to Santa Cruz, California. And Alan, you're on with Melissa.
Hi, Melissa.
Hi, Alan.
This is Alan. Hi, how are you doing?
Pretty good. What can I do for you today?
I'll give you some history. I'm a 51-year-old man. I'm 6'3". I weigh 174 pounds. I eat. I try to stay away from processed foods. Eat organically. I'm fairly active. Generally in terrific health. However, in my family, our thyroid glands shut down, and it happened to me back in 2000, and they put me on synthetic thyroid. I guess it comes from pigs, is what I heard, called levothyroxine. And I'm wondering if there is something else I could do, or is there a way to get the thyroid back to working?
Yes, there is. There's definitely a way to do that. So the first step is to get your doctor to change your medications to either Armour thyroid,
what is that?
Armour thyroid, ARMOUR, and then it's thyroid, or Nature Throid. They're the exact same thing. They're just two different brands. So Armour thyroid, yes, Nature Throid. Nature, and then Throid is TH as in Harry, R as in Robert, OID as in David. Nature Throid. And they're the exact same thing, and they're actually the active thyroid that's going to directly act as needed in your body. So you want to get off the levothyroxine. If your doctor gives you any flack, you want to find a new doctor. So you want to get that prescription. That's the first step. Simultaneously,
those are prescribed only substances?
Yes.
Okay. And what's the next step?
The next step would be to get on our product, Ocean's Gold. And then there's another product that I really like that's outside of longevity. It's called Lugol Solution. But we could talk about that outside of, I can give you my email. It's melissa@nutritionalpharmacist.com. Ocean's Gold may do the trick. I'm sure it will at the right doses. But what Ocean's Gold is going to do, it's also going to be nurturing your thyroid and giving it the energy to rebuild and regenerate. But the number one thing that you have to do, Alan, is you have to stop eating gluten. Are you still eating gluten?
Here and there, yes.
You need to stop completely. So there's a huge link. Yeah, there's a huge link between the thyroid and gluten. And when gluten is in the body, because of the irritation it causes in the digestive tract and so many other things that happen when we eat gluten, the body gets really revved up and becomes pretty much like a, on fire, inflammatory. It's just everything's on fire. And one of the things that happens, everyone's going to manifest it in a different way. And in regards to your family having a pattern, it's mostly all linked to the fact that you're all allergic to this, this irritant, which is what gluten is, and it's contributed to your thyroid getting damaged. Other people might manifest their inflammation in a different way, but your family, obviously, the thyroid's the weak point, if that makes sense. So no gluten.
What is Ocean's Gold?
Ocean's Gold is one of our products that does have iodine, not directly in it, but it nutriates the thyroid with nutrients. So it's a great product to add to your regimen. Are you taking other Beyond Tangy, other longevity products?
No, I'm looking into it right now. And so
okay.
Ocean's Gold is a longevity product, correct?
Longevity, yes, sir. And since you're not taking anything, you need to start on the Healthy Body Start Pack and then add the Ocean's Gold. And you can definitely shoot me an email and we can fine-tune your regimen. So, again, Melissa, nutritional pharmacist, and thank you for calling, Ellen. I appreciate it.
Well, that's all the time we have for today. Thanks for sitting in today, Melissa Golloday, nutritional pharmacist sitting in for Dr. Wallach today. And we will be back another day, so stay tuned.